I'm Kendra Newell. I was a patient at Princess Margaret Hospital after a diagnosis of triple-negative breast cancer. My profession is an OBGYN. I'm aware of a lot of the places around that do a lot of pelvic physiotherapy. Cornerstone was one of the ones that came to mind. I also knew one of the founding owners that I was able to reach out to, and he was able to give me advice on some newer programs that they had established. And one of them was looking at rehabilitation for post-surgical patients, and specifically breast cancer patients. Throughout chemo, there's the common side effects. So fatigue, definitely one of them, the nausea, but it's the other things. So chemotherapy for a lot of perimenopausal women puts them into menopause. And so with that, you get headaches, you get joint pains, you get hot flashes. I also experienced a lot of dizziness, and it's actually one of the reasons why I sought out treatment after my chemotherapy and surgery, was that I was struggling with balance and with dizziness. The hard part is when you have a length of time between the treatments. So for instance, between treatment and surgery or just after surgery. And you're given a pamphlet on exercises that you can start doing, but there's really no other resource that you have access to at that point. You feel a bit lost. You feel you've had all of these people watching you every week, and then all of a sudden you have surgery and you're left. That was probably the hardest part for me. Yes, you're medically cleared that you finished the treatment, but your body has changed, your mental state has changed. That to me is where the building has to begin. It was incredible. You leave the hospital, you're not feeling great, you've got these 2 drains coming out of you, and you don't really know where to go. It was really good to meet somebody who was an expert in this area, who I could trust that I wasn't going to damage anything from a surgical perspective, and it was going to help me in the healing journey. My mobility increased quite rapidly, and I would say that my healing process post-mastectomy was quite easy. I have started back working out to my regular routine. I must say, Natasha had me back working out to some capacity after we had done all the stretching and that initial rehabilitation. But now I'm getting back into my regular routine. You're not alone, that most people feel this way. I was fortunate that I had kind of looked beforehand and had knowledge about this program. But the hardest part of finishing cancer treatment is that you feel alone. And you really don't know where you're going to start with that rehabilitation. If you get into a program like Cornerstone, somebody else is giving you that power to make the change. So they are directing you, they're coaching you on a weekly basis. And they're also there for support. And that is exactly what you need. And I say it to all my patients as well. The hard part is that we need a program that is individualized for everybody, because not everybody comes in to their cancer diagnosis in the same physical condition or mental condition, and not everybody leaves it the same way.